Hello and welcome to the AIAMC podcast. I'm Kimberly Pierce Burke, Executive Director of the AIAMC, and I am so excited to be visiting today with two of our shining stars from Columbus, Ohio, Dr. Joy Walton, who is the Associate Program Director of the Internal Medicine Residency Program at OhioHealth Doctors, and her associate, Dr. Alexandra McKenna, who is the Associate Program Director for the Family Medicine Residency Program at Doctors Hospital in Columbus, Ohio. So ladies, welcome. We're so thrilled to have you here. And OhioHealth, of course, is one of our founding members of the AIAMC. Of course, at the time, it was Riverside Methodist Hospital before it grew into this large conglomerate that it is now, but has been such a loyal member for many years, two-time winner of the AIAMC Innovation Award. So we're just thrilled to be able to spotlight your National Initiative 9 project. Of course, NI9 is on addressing the social and moral determinants of health. And I read with interest your storyboard that you had out at meeting 2 when we were together in April in Tucson. Your NI9 project is called Advancing Healthcare Equity, or ACE, Creating Medical Neighborhoods for Vulnerable Populations. So Dr. Walton, let's start with you. Can you tell us a little bit about your National Initiative 9 project? And then maybe Alexandra can share what's been a highlight for her thus far.
Absolutely. Thank you so much. So our project is centered around the fact that Doctors Hospital serves a close-knit community that lives largely within a 6-mile radius of the hospital and is a population that is incredibly vulnerable. And by vulnerability, we talk about exactly what our NI9, theme is, which is social determinants of health. There are folks that come from incredibly vulnerable neighborhoods with housing insecurity, food insecurity, transportation challenges, financial strain, and we know that that is a driver of health outcomes. Zip code matters more than genetic code when it comes to these health outcomes. And so, as we were thinking about this population, it happened to coincide with a larger initiative that OhioHealth Doctors Hospital had took on with population health and wanting to really bring about health equity. And so that was for a long time called the Population Health Clinic. It's been officially given a name, OhioHealth Community Care at Doctors Hospital, or Community Care for short. And this clinic space is meant to be a bridging space, a bridging type of care for vulnerable communities, and to provide patients with whatever access they need in order to finally get into a primary medical home. And we just know that in addition to all of those vulnerabilities, these patients are incredibly medically complex and require a lot of different types of care. And so we wanted to be that bridge for those folks, and that is what community care is doing. We just opened our doors last Wednesday on July 10th, which is super exciting, and seeing our first batch of patients. And already I have amazing stories of folks that just didn't have primary care and didn't have access, and were utilizing places like the emergency room and getting admitted, subsequently maybe readmitted. And folks that we were able to, connect into whatever they needed, whether it was medication refills, management of their diabetes and their hypertension, while also then eventually getting them into a primary medical home. And then on top of that, having on-site social work and case management and community health workers to really directly intervene on some of those social determinants of health that are barriers to their care. And so that was really neat to be able to already start doing that work. And again, and aligned with the project that we took on, which is really looking specifically at are we paying attention, and how are we paying attention to social determinants of health in that type of a setting, and how can we continue to standardize that work and do it better. So that's kind of the summary of our project, is providing bridging care to vulnerable communities at Doctors Hospital. And it's really, really, really wonderful and rewarding work. And we're just sort of putting one foot in front of the other. And it's been fulfilling.
Wow. So impressive. And, talk about going way above and beyond our typical resident-run clinics. I mean, this is really targeted to care for your community across the disciplines, multi and interdisciplinary approach, bringing in all the key stakeholders, Super impressive. So, Dr. McKenna, and, Mindy and I were chatting before, and I said, wasn't she a resident before? So I just remembered your name. And so what's been, as you're transitioning, into being an attending and leading this work, what's been a highlight for you thus far with this community care clinic?
I think I've been with Ohio Health since 2015. And so I've had the opportunity to work on other projects, Jedi being the prior one,
Oh,
and the work that it's done. And it's been really amazing to see how a project like this can bring so many people into the space that you're working. And I think Joy and I have found that we don't ever want to say no to anything. So we're constantly just accepting people's connections. And it's really amazing to see how, the hospital, the group that kind of runs our GME departments, all these external community partners have really come together. And huge props to Joy, because she also connected us with medical students. So
mm,
they were in their first, going into their second year. And I mean, what an amazing group of people to tap into, because they have all that potential, all that excitement that they bring. Um, and she charged them with these like awesome tasks to really research and understand what is going on, what kind of background existed. And they
mm.
brought so many ideas. In fact, they brought a community connection for us, which was amazing. They were on the airplane back from AIAMC conference, the first one, and they met somebody on the plane who was a physician in Columbus. He was an ER who started a recovery center for substance use disorder. And so we
My
went and
gosh.
toured his facility, and we learned about how he works with this really vulnerable population. And they've become a really great partner to learn from as we implement the work. So that to me has just been one of the highlights, is how many people there are who are actually interested in this type of work, and how many ways you can get connected.
Mhm. Wow, that just warms my heart, and that is so gratifying because I think too often times residency training can just get so siloed, and you're just so like, you know, what rotation am I on this month and what am I doing next? And something like this that can just really literally broaden the horizons and, to make those connections is just something that I don't know how we quantify that, but we know the quality that brings to the training must just so more richly prepare one for practice. So that's wonderful. And the two of you clearly are very enthusiastic about this project. I mean, I can see it and I hear it in your voices. Um, but let's face it, we're about halfway through National Initiative 9. The beginning is always, oh, yeah, we're going to solve the world's problems. We're going to do this. Sometimes there can be a little bit of a slump, or energies might go down a bit. Now, if you just opened on July 10th, you're probably still riding that high. I know I would be. But when those little slumps come, how do you keep yourself, or we're going to talk in a moment about barriers, when something kind of doesn't go the way you thought, how do you keep your motivation going, and how do you keep your team motivated and keep their eye on the prize? Any advice there?
Yeah, that's a great question, Kimberly. I was thinking about this. I think that, as Dr. McKenna was talking about, it's really the energy that comes from all our different partners, and that helps us to sort of refocus and remember some of the success stories. On our opening day, our ribbon cutting ceremony last Wednesday, Dr. Graysall came with his base camp recovery folks, and they were there just standing next to us, and they just encouraged us. Remember, this is we remember when this was just a twinkle in your eye, and here you are, opening your doors, and just reminding us that it is a journey. And there are Sherpas along the way that encourage us, and tell us we're going to get through this mountain. And then when we get to the top, they're going to celebrate with us. So that's been really encouraging, just to almost leverage some of those partners' energy as well. I do think that our medical students have energized us a lot as well, because they bring such just a fresh set of eyes and innovation. They're very engaged in, justice. I think justice work for the culturally relevant moment that we've lived through is something that really resonates and helps them understand the why and want to get behind the why. I do think that when I think about times when we are kind of slumping and we sort of feel like, okay, boy, boy, yeah, I do feel the halfway point. That sounds about right. Looking back and celebrating those small victories and every little success that we've had, and just how it's led to really tangible, palpable outcomes and successes. And so, an example would be just the fact that we also engaged at one point a group of Ohio State undergraduate students who put together a resource document. And just last Wednesday, I printed out that document and filed it away in our I'm kind of creating a resource document in our community care clinic that we'll just have as a quick reference. They vetted those resources for us. They were able to give us quick ins onto how to access those. And so that was just so I was smiling as I'm putting them in lamination sheets and sort of saying, this work, it wasn't in vain. It came to something. The interviews that some of our residents executed on some of these external partners and talking to them about how do they navigate social determinants of health, what is the work that they have done, where have they won, and what are some learning strategies. We've taken that and started formed best practices and then been able to use that to guide us as we move forward. So every little success story. I remember at the beginning of this, Kimberly, you told us don't boil the ocean. And I put that in the back of my head because I get it. It is a lot of pie in the sky and sort of we're trying to be everything to everyone. And, Dr. McKenna has summarized it as sort of an FQHC within, a non-FQHC organization. And so it's a lot, but celebrating every little victory that we have and realizing that it's moving the needle in the right direction. And so that's been something that has helped. And I think, especially for our students and even for our residents too, remembering like this is something that is in real time helping people. It is something that is being implemented. It's not just sort of your bench research. It is resulting in tangible change and good things, not just for community care and our direct community that we serve at Doctors Hospital, but potentially work that's going to be lateralized across the organization. So that's really exciting. I think that's rewarding for folks to remember. And then the last thing I'll say is you talked about sort of, metrics of success. And one of the things I think is just hearing patient stories too. And so I've already started to, we've seen 5 patients since we opened our doors, but I've already kind of kept a running list of here's what we did for each of those patients versus if they were in a traditional sort of setting or in the emergency room where you didn't have those resources, these are the ways that these patients would have fallen through the cracks and either ended up hospitalized in the emergency room or without access. And so those have been little nuggets that I've just kind of sort of said like that's one person we helped and and that's kind of why we're all here to help sort of the person in front of us. And so I think that's been rewarding as well. And another metric of success I would say for our students and residents would be, because you sort of asked like how would we measure that? For me it would be if those students and our residents came out with a lens of social determinants of health. Like that's the type of training I feel that 15 years ago I definitely was not on my radar at all. And so if they come out with that lens to look at wherever they practice, that's a win. And even more is if we then inspire them to now you have served and trained with vulnerable communities to inspire them to continue to want to do that work in their long-term career. Oh boy, that would be for me, that would be a huge metric of success.
Yeah, absolutely. Talk about sustainability of a project. I mean, this isn't a project. This is a foundation and beginning of something that will go on for we hope a long time. And I love hearing, celebrating every small success. I think that is so important. And then the storytelling is so impactful. And I would really, I encourage you to, to capture those, even if you just tape yourself orally. I mean, some way to share those stories is really, really important. So I read your storyboard with interest, and a barrier that you talked about was you talked about, I can't remember, something asking the right questions. So either that one or does something else come to mind that bump in the road? What was that and how did you overcome it?
Yeah, I think I'll take that one. This project actually, there were pieces of it that were already moving before AIAMC. And so Joy and I have been involved in this work for a couple years now, I think, in some respect. And it's been very interesting. We sometimes have to laugh because we've had to really reinvent the work and continuously redefine where we're headed and what we're trying to do. And I think it's probably a part of that, like, don't boil the ocean, right? Like there was this huge vision. And at the beginning, even when we submitted our original proposal, we had a very clear metric that we were hoping. We really wanted to, decrease hospital ER utilization. And I think we started to realize that that is much more challenging than just moving patients to a different environment. And so the real big barrier that we encountered was recognizing the complexity of the healthcare system. And I don't mean just ours, but just the way healthcare works in America. And the reality is, like, the way, contracts work, the way those relationships work, how money moves, it's important. It's still a business, which I think as a healthcare provider, that's never been at the forefront of my mind because it's just put people first. But it's a good thing that I have other people who manage that part. I do the healthcare. But I think we started to encounter some barriers where we just started to recognize how crucial those relationships were, how impactful. It was really important to be mindful that one decision that we made actually had probably some really big downstream effects to other departments, and that they were not really in favor of. And it wasn't necessarily because they didn't agree with the premise of our project. It was just that it was going to have really different impacts for them than it was going to have for us. And so we actually had to pivot a little bit on our project. And it was a really big work stream pivot about 6 months ago, to suddenly realize that we were going to need to really reinvent how we were really addressing our patients, where we were going to access them, how we could best serve them, which meant we needed to kind of redefine how success was going to look for us. I think Joy and I talked a lot about, a year, 2 years down the road, we're actually going to see that number we were shooting for in the beginning, at the onset. It's going to improve whether or not we directly tried to impact it, because it's a downstream effect of the work we're doing. But yes, I think the biggest barrier was understanding the complexity of the healthcare system and how everyone has wonderful intentions and people really do want to put the patient first. And then there's all those other things to consider at the same time.
Yeah, I'm so well put. I mean, those unintended consequences that, we're all here for the right reason and we all want the same thing, but it can be so complex, and the ripple effect of, how that all plays out is so important. Well, our time is almost up, but and this whole talk has been inspiring to me personally. But just quickly in a sentence or two, what inspires you? We talked about a slump and keep it going, but just overall, what about this work has inspired you the most?
Yeah, I was thinking about our recent conference in Tucson and how the final speaker said a mantra that I have literally just adopted, and it's true. I do not make this up. She said, "The answer is yes."
Yes.
And I took that to heart, and that has literally been something that I have gone by since we opened our doors, and way before that as well. But I was telling Dr. McKenna just this weekend, getting texts from other physicians. Can you see this patient? I met this lady at church who needs, a mammogram. I have a yoga instructor and her daughter who don't have a primary care physician. And this morning, getting emails from another addiction medicine director. Finding out from OhioHealth, which is another kind of care management organization, we'd like to collaborate. The answer is yes. The answer is yes. And sometimes it's overwhelming, I'll be honest, sort of keeping things straight in my head of all these potential collaborations and partnerships. But I have found that, and not all of them lead to something, and that's okay. But by saying the answer is yes, it has really opened doors, and you just never know where they'll lead. And I found that attitude and sort of that posture has been a really, really wonderful thing. And so it's unlocked some special partnerships. So the answer is yes. I love that. I take that to heart.
I love that too. What a wonderful way to end our conversation. Let the answer be yes. I completely agree. So I want to thank both of you so much, not only for being with me today, but just the work that you're doing and putting your heart and soul into this work. It's clear that the patients at Brown Doctors Hospital in Columbus are most fortunate indeed to have you. So thank you to Dr. Walton. Thank you to Dr. McKenna. Those of you listening in, we do hope that you will subscribe to the AIAMC YouTube channel. You can also follow us on social, on Facebook, LinkedIn, Instagram, and Twitter. And again, my sincere thanks to our speakers and to those of you listening in. The answer is yes. Thank you.
Thank you.